Hello, my name is Clifford Brown, and I'm the president and CEO of EduMed Networks. First and foremost, I'd like to thank you for the opportunity to share EduMed's vision and our plan to tour the United States across the country, city by city, state by state, to educate, chronicle, document, and even share real-time information from those just like you, just like me. We're going to talk about COVID-19, the vaccines, the variants, and their devastating effect on communities and our country as a whole. I'm sure you'll find that the information that we provide will help you to navigate yourself and your family through this most devastating pandemic. Let's go back to the beginning, January of 2020, when the first case of COVID-19 was reported in the United States. As you can recall, quickly after that, there was pandemonium. No one understood what to do, how to do it, or even why. We all felt like the information wasn't coming fast enough, and in many cases, the appropriate information never made it. We weren't being transparent. We weren't sharing the information. Now, we're at a point where over 600,000 lives have been lost as a result of the pandemic. Many of those possibly could have been saved. Now we have the vaccine, but yet we have the Delta variant, and we're still stuck on information that is not quite being provided. We're not transparent. We're not forthcoming. So EduMed's vision is a grassroots effort to provide you with transparent plans, thoughts, and real-time responses, not only to the vaccine, but also to the virus itself, to the variant, but also how communities are coping, how school systems are coping. Every week, you'll see a new episode in a new city that will give you information from the residents, the politicians, the doctors, the community support organizations. They'll help you to formulate new pathways, and they'll share with you what those like yourself are also battling. We want to help eradicate this virus for you, your family, and your friends. Here's how you can help. At EduMed, we realize that it doesn't just take the effort of our government, but it takes the efforts of all of us. And I urge you to join us, support us, share the information, make sure all of your friends, all of your family members are seeing the information that we broadcast every week. Because without it, we just continue to 700,000 deaths, 800,000 deaths, maybe 1 million. I'm tired of seeing my family, my friends, your friends die from this devastating disease. Let's stop it. Let's join hands now in an effort to fight, and let's get it done. We're asking for $150,000. You're viewing a visual of expenses incurred during the embark of the Path of the Vaccine tour. As I noted earlier, we know that it takes a village to raise a child, yet it takes that same village to save our families and our communities. COVID-19 deaths and the level of human suffering are real. The science is real. Now is the time for us to join our efforts and trust in each other. Your generous financial donation will help us in changing the narrative, the flow of information, the suffering, and the increasing number of deaths related to the pandemic. We are that village, and collectively, we're being called upon to act. So please help the Path of the Vaccine meet our financial needs. Those needs include marketing and advertising at 10%, production costs at 20%, administrative needs at 10%, travel and lodging during the tour is 20%, studio rental is 8%, staff insurance during the tour is 7%, equipment rentals 14%, and our miscellaneous costs, which is unforeseen costs during the tour, is at 10%. You'll find a complete listing below. In the United States, we're reporting over 137,000 positive COVID-19 cases per day. Yet, more than 85 million remain unvaccinated. The CDC predicts that COVID-19 and the Delta variant will push the pandemic death rates to 664,000 by mid-September. Now, I'm confident our efforts will make a significant difference in saving lives. Together, we can fight and we can win this battle. Our goal is to make sure that you have relevant and timely information that will help us stop the spread, stop the suffering, and save our communities. I need you to help us get this done. Thank you.